So this week we're looking at policies, laws, and ethics. So this lecture is going to focus on the ethical considerations of public health and human subjects research, because if you move forward in this field, these are some really important things that you should know in how we treat people, how we got to this point, and so on. So let's begin. At first, as the public health needs have increased in complexity, there's been renewed attention given to the ethical dimensions of public health decision making. So that leads us to three core terms that we're going to use. The first is ethics. So ethics are a branch of philosophy concerned with the ways of thinking philosophically about morality and moral judgment. What do I mean by morality? Morality is human conduct and character, referring to those acts which it makes sense to describe as right and wrong or good and bad. So morality allows us to paint a narrative of this action is good, this action is bad, or this action is right, or this action is wrong. Moral judgment means that we are making judgments based on considerations of how other people are to be treated and how other interests are weighed against their own. Now, routinely in public health, scientific considerations blend with political and ethical conflicts, questions of autonomy, individual rights, coercion, social justice, community and the common good, the norms of research, and multicultural values. Public health ethics involve a systematic process to clarify, prioritize, and justify the possible courses of public health action based on ethical principles, values, and beliefs of the stakeholders, the scientific information, and other information available. So when we think about what these factors mean, what do we mean when we say that we consider the science blended with questions of autonomy? Okay, so think about the abortion debate. Okay, a question of autonomy would be, does a person under 18 have the right to get an abortion without parental consent? Are they autonomous? Okay. It could also mean someone that has a mental disability. Can they make decisions about their health care, or even research related to their health care? We also have to consider what the science says versus individual rights. So for instance, we're going through the whole COVID pandemic right now. One of the biggest considerations of whether or not we lock down had to do with how much does the individual right to travel, to go out into the world, how much does that weigh versus the societal right to protect people from catching this virus. We also are concerned with the common good and the community good. So this is where that individual rights and the community good come into conflict, right? You can see where the best thing for an individual may not necessarily be the best thing for the common good and the community. So going back to COVID again, the community good would say that we need to isolate so that we prevent the spread until we understand the virus better, until we can get either a cure or a treatment because of just the sheer number of people who are dying from it. However, individuals, those who are asymptomatic or those who are relatively healthy and may be at less risk of dying, may feel that their rights are being trampled on because of this. So when we talk about the ethics related to public health, these bullet points that I have here on the slide are some of the many things that we have to think about. Thinking about social justice, right? We have to make sure that the public health interventions are both fair and equal for every group, that we're not punishing one group and that we are not excluding a group. Okay? Now, as a field of study, public health ethics seek to understand and clarify principles and values that guide our actions as public health workers. So, as a field of practice, public health is the application of relevant principles and values to decision making. And this carries out three core functions. First, we have to identify and clarify the ethical dilemma posed. Then, we have to analyze it in terms of alternative courses of action and their consequences. Finally, we resolve this dilemma by deciding which course of action best incorporates and balances the guiding principles and values of the public health field. So, going back to the individual rights versus the community right, we have to look at what dilemmas does this impose. Does allowing the individuals to have more rights during this COVID pandemic, does that create an ethical dilemma? Well, then we see that we could be infecting people who are at high risk that didn't choose to come into contact, that we're trying to isolate or what have you. So we have to then try and look at, well, what other dilemmas if we lock down? Well, then we are trampling on those rights. So now we have to analyze what could happen. We have to look at all these courses of actions that we could do. We could do a complete lockdown and quarantine. We could do temperature checks at every public building, facility, store, what have you, and anyone who has a temperature higher than the normal would not be allowed into those places. We could also make everyone wear masks. We could look at all these different actions and what are the consequences for it, okay? Because we were so late in approaching this issue, we were forced into lockdowns because we're trying not to overwhelm hospital systems. This is what resolving the dilemma means. We had to decide on a course of action. We took too long to come up with a course of action, and that's kind of where we're at now. And we're trying to balance it by allowing people that need to go to the store or the grocery store or something, that we can keep those kinds of places open, but you should be wearing a mask. You should be practicing social distance. If any of you go into a Publix right now, there are signs telling you which way to walk up the aisle, right? All these things are trying to balance out these principles that guide every health decision. We're saying social distancing, keep everyone 6 feet or more away, wear masks in public, and that way there can still be some autonomy. There can still be some individual rights, right? You can still go to a park as long as you don't get within 6 feet of people. Most parks are still open. Most hiking trails are still open. Grocery stores are still open. So the individual still has some rights, but we are mostly focused on the rights of the community good to protect the most vulnerable citizens. Now, we have other things to consider when practicing public health, especially this balancing act between providing services for the good of the community health versus the individual rights. We have a responsibility to provide services and allocate funding and resources to those that need it, but sometimes those decisions need to consider ethical principles to ensure we're doing the best we can for everyone. As new issues and threats enter our domain, we need to constantly consider the ethics of what we do. So we have a moral imperative to ensure and protect the health in the population and the health of the individual. So, because we all have a right to health, okay? We are all responsible for the health of the population, okay? So, we have a right to be healthy, and that also means that we have a right to protect the health of other people. This is where wearing a mask and social distancing come in, okay? There is also, we have to consider what the effects of doing something or not doing something could be, and what are the effects of best practices. So as COVID hit us, we saw some of the best practices: washing your hands for at least 20 seconds in hot water with soap, using antiviral, antibacterial sanitizers, wearing the masks, right? These are all considered best practices. We have to keep in mind, though, nearly every day we have new issues arising. There are new disasters, new diseases. COVID is called a novel coronavirus because it was a new coronavirus. Now, here are some things to think about when it comes to the individual rights, okay, and some of the public health ethical issues that come up. We all have the right to quality health services. We also have the right to know that whoever our provider is has acted in the benefit of us. Okay? One of the more, what you would say, controversial ideas of the individual right is euthanasia, the right to die. Okay? Now, this is one of your paper topics that you have due this week. Do we have the right to decide that we can die? Well, in a way, isn't that what hospice really is about? Hospice is a system where someone who is terminally ill is no longer given treatments. They are just given like painkillers or pain relievers, and they are allowed to die with some dignity at home from whatever disease or disability has debilitated them to that point that they can no longer be treated. My grandmother died in hospice care. She had had a stroke at 92, and for about a year, she just continued to waste away to the point that when she finally passed away, that she had no understanding of where she was, who she was with. She couldn't speak anymore. If she had been capable of making a decision and had told us that, please just let me die, would she have that right? So this is something you all, if you decide to talk about euthanasia in your paper, this is something that you can think about. Which side does the public good belong on in the individual right? Which side is in the better interest of the individual or the public? Another thing that we have is the right to confidentiality and the right to privacy. Okay, but this comes with a caveat. Okay, if you get tested for a disease that is monitored by the state, they turn over all of your information to the health department. Your doctor is required to. Okay, so for instance, if you are HIV positive, everything about you is turned over to the health department. And those people working in the HIV section of either epidemiology or community health assessment have all of your information, your name, your social security number, your address, your phone number, everything about you. So we have an expectation of confidentiality. That's our individual right? And we expect that. At the same time, there's a community right to know if someone has a disease that is potentially impactful to the broader community. So I worked in community health assessment as the Zika epidemiologist. If you tested positive for Zika, or even if you traveled to a country where Zika was very prevalent and you were pregnant, I got every bit of information about you, from your name to your social to your partner's name to your address, your phone numbers, the name of your doctor. I got all of your tests, right? And that's because that public good is considered more important than the individual right to confidentiality. Another thing that we have is informed consent, okay? This means that I have to have you tell me specifically that you consent to a specific treatment or a therapy or a research project. You have the right to know what the risks are. You have the right to know what I'm trying to do with this information. And so this is considered an individual right that is, for all intents and purposes, it is guaranteed. Okay, there are some exclusions to that. If we feel that whether or not you give consent, it could still benefit the community. There have been cases where informed consent has been excluded, but in most cases, you have to consent to being a part of a research project or a special kind of test. So, for instance, thinking about COVID again, if you have COVID and you're positive, the doctor has to get consent from someone before they give you either the anti-malarial drug that we're seeing so much in the news, or even a new vaccine. They have to get consent from you before they can give that to you. Thinking about birth control, religion would be considered a group right. right? Think about groups like the Catholic Church. They're pretty anti-birth control, right? But there's also this individual right where women have the right to control what they take into their bodies, whether this is a birth control method such as the IUD, which can be hormonal, or it can be a copper T, okay, or other forms of birth control like the pill. Um, there is a weight there where we have to consider: does the religion's right and beliefs about birth control outweigh those individual rights, and vice versa? Overall, we have decided that the individual right outweighs the group right when it comes to this specific topic. We also, as we've mentioned in earlier lectures, we provide incentives and disincentives for certain behaviors, right? So if we want you to quit smoking, we pass laws to raise the smoking age, to tax it more, to criminalize certain behaviors, okay? The last two, equity and social solidarity, kind of go very much hand in hand. So when we say equity, we're talking about that everyone is treated equally, okay? And social solidarity means that we are together on whatever the treatment is, on whatever the method is. Most people are okay with the lockdown. They don't like it. I don't know that any of us actually like it, but most of us understand why we're doing it, and we are okay with it, even if it is an inconvenience to us. Now, to put into context why we need to consider ethics, let's talk about a few historical aspects that have driven our current and future decision making in public health and public health research that involve human subjects. Now, research is necessary to ensure we move forward and discover new medications and interventions that can promote healthy living and improved health outcomes, but we always have to consider the impacts these practices have on people. A few major historical events drive our ethical principles today. Now, the first one was the Nuremberg War Tribunal in 1947. In this, there were criminal proceedings against 23 leading German scientists and administrators for their willing participation in war crimes and crimes against humanity. Horrifying procedures were conducted for research purposes on thousands of people in concentration camps without their informed consent. So this is where the idea of informed consent really is born, is when we started looking at how in the Nuremberg, how the scientists were just experimenting on people. They didn't tell people what they were doing. They gave them drugs, didn't tell them what they would do. They did surgeries, they did experimentations, never asked anyone's permission. They treated the Jewish people who were in those concentration camps like animals and treated them as if they were lab rats. Another study that was very similar about this idea of informed consent was the syphilis study in Tuskegee, or the Tuskegee experiment, as it is more colloquially known. Okay, as part of research conducted by the U.S. Public Health Service, 600 low-income African American males, 400 of whom had syphilis, were monitored for 40 years. Free medical examinations were given. However, participants were not told about their disease or provided a cure when it became available. Instead, we studied them to see what long-term syphilis would do to a human being. Okay, so in some cases, when participants were diagnosed as having syphilis by other physicians, researchers intervened to prevent treatment. Many participants died of syphilis during the study, and the study was stopped in 1973 by the U.S. Department of Health, Education, and Welfare only after its existence was publicized and became a political embarrassment. Okay? It's not like it was stopped because the scientists realized that what they were doing was unethical or wrong. Instead, it was when the media got involved and pointed out just how horrible this was. In some cases, during the Tuskegee experiment, we told these men that they were being given a cure, and in fact, we were giving them a placebo. All so that we could study what the long-term effects of syphilis would be in a human being. The third case involves a drug that was used to combat the symptoms of morning sickness, which is part of pregnancy. Now, it was not disclosed to patients that this drug was investigational and still in the testing phase or in the regulatory phase. It was told that this drug was a cure, it would be good, use it. But the people who were treated with the drug soon discovered that it had some teratogenic effects that caused severe deformities in the fetus. It was soon banned worldwide, but approximately 12,000 babies were born with severe deformities due to this particular drug. The last one that I have on the slides were the radiation experiments of the 40s through the 60s. U.S. officials studied the effects of radiation through experiments on hospital patients, pregnant women, mentally disabled children, and enlisted military personnel. Few of the participants of the experiments ever gave informed consent, and most had no knowledge that they were being subjected to radioactive materials. This is part of the Manhattan Project. Okay, the Manhattan Project officials authorized these wartime experiments to establish the health and safety standards for thousands of workers in atomic bomb plants. A last one that I'll talk about that's not on the slide is the invention of gynecology. Gynecology came about through experiments on black women in prison. Okay, the whole field is born from these prison experiments. These women did not give consent. They did not even know what was being done to them, what they were being treated for, why the doctors were inspecting them. Many of these women were made sterile through the course of this experiment, but all of modern day gynecology is predicated on those particular experiments. Every bit of this that I've talked about is horrific. Okay, this is the dark side of science, that when not monitored, when not regulated, it can lead to some really dark and disturbing aspects of humanity. Let's talk about 3 more. First, I uploaded 3 new videos this week. I want you to watch them because I think you'll enjoy what you see, but also they are very important to the development of social science and social science experiments. So these 3 do not involve drugs. They involve instead psychology and social psychology. The first is Baby Albert. Okay, that video, there's a lot of dead silence. You can kind of watch the first couple of seconds to hear what the experiment's about, and then kind of fast forward a little bit and watch the reactions. But in this, they take a baby, an infant who's about 6 months, 7 months old, and at first they give him like a fluffy little bunny. He plays with the toy. He gets really happy when the toy is around. But the whole purpose of the experiment is to show that fear is a learned behavior. So they bring this little toy bunny, then they introduce like a white lab rat and a dog. At first the baby loves all of these things. As the experiment goes on, then the baby has to be taught fear. So what the researchers do is that they bring out the lab rat or the bunny or the dog that the baby really loved, and every time the baby goes to touch the dog, they sound an air horn in the baby's ear. They make this really loud sound that is terrifying to this 6-7 month old infant. They do this often enough so that when the baby sees these animals or stuffed animals, he freaks out. Now, I can't even imagine the psychological problems that this particular experiment did to this child. Okay. The second one on your screen is the Stanford prison experiment. Okay. Now, this took place at Stanford University, under the direction of Phil Zimbardo. Okay. Now, Zimbardo wanted to show that you could have a group affiliation and it would determine your behavior. It would determine your personality even by just being a part of a certain group. And so to do this, he hired young men attending Stanford and paid them to sign up for this study. He divided them equally into 2 groups. Now, in the basement of his lab, he built a prison. Okay? And he divided these 2 groups into prisoners and prison guards. This experiment was supposed to go on for like 6 or 7 weeks, and it ended in 6 days. And that's because it became abusive, it became psychologically horrifying, and it was shut down. Okay. The last is the Milgram experiment. This is the most famous of these types of social science experiments. In the Milgram experiment, the researcher was trying to prove that an individual would not obey authority if they were told to do something that would harm another person. So to kind of understand, let's talk about who Milgram was. He was a child of a family that escaped the Holocaust. He believed that there was something innate about Americans, that independence was in our DNA, that we would refuse a tyrant. If asked to do something that would be horrifying, Americans would say no. He believed that there was something deficient about the German people that allowed them to fall under the sway of Hitler and do those horrible acts to the Jewish populations in that part of the world. So he designed this experiment to prove that Americans, through our independence and our values of freedom, that we would not follow authority. And what he found is that if a person was asked to press a button delivering electric shocks to another person they couldn't see, as long as the researcher or person in asking was viewed as an authority figure, the person operating the switch would press it all the way up until the other person supposedly died. Okay. The video that's uploaded on this is a new, updated, modern version of this. It's called Are You Evil? I suggest you watch it. It's like a game show, but it's the same exact experiment. The young man is sitting in front of a selector switch that delivers electric shocks to a person in another room that he can't see. He just can talk to the person. In the original experiment, it was a recording, so it was the same, statements every single time to every single person. Where the person would be like, ow, that hurt. And then after the second shock, they'd be like, my heart's starting to hurt. And by the end, they would be like, I think I'm having a heart attack. And then there would just be dead silence after the last shock. Now, as I mentioned, it was the Nuremberg War Tribunal that was one of the major instigators to this idea that we need protection on research subjects. That was this bringing to light these Nazi atrocities in World War II showed that we didn't have any standards on research with human participants. So this led to the founding of the Nuremberg Code. The thalidomide disaster led to the adoption of the Kefauver Amendment. So this required drug manufacturers to prove to the FDA that their drugs are safe and that they're effective, that they do what they say they're going to do, and it also required physicians to obtain informed consent from any potential subjects before giving any investigational medications. So this is like when I was saying earlier, you would need informed consent before you could give a drug like the hydrochloroquine antimalarial drug, or even a new vaccine for COVID. You would need informed consent before you could administer those drugs because they are considered investigational. The last one mentioned here was the Declaration of Helsinki. This was drafted by the World Medical Association in 1964. They updated it in 2000. It builds on the Nuremberg Code and is considered the basis for good clinical practices used today, which involves informed consent, and things like that. Now, the National Research Act of 1974 was passed primarily in response to the Tuskegee experiment. It codified the requirement that human participants in research must be protected and set the stage for the issuance of the BELMONT report, which we'll talk about in a second. Now, it was used to create the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. So this included things like the Baby Albert experiment, but also things like the Tuskegee experiment. This commission was charged to identify the basic ethical principles that should underlie the conduct of biomedical and behavioral research that involve human participants, and to develop guidelines which should be used to assure that such research is conducted in accordance with those principles. The Helsinki Declaration was used to provide guidance to physicians in biomedical research on anything that involved human beings. So it was the mission of the physician to safeguard the health of the people. Their knowledge and conscience were dedicated to the fulfillment of this mission. The Declaration of Geneva of the World Medical Association binds the physician with the words, "The health of my patient will be my first consideration." And the International Code of Medical Ethics declares that a physician shall act only in the patient's interest when providing medical care which might have the effect of weakening the physical and mental condition of the patient. So, the purpose of biomedical research involving human subjects must be to improve either diagnostic, therapeutic, or prophylactic procedures and the understanding of the pathogenesis of disease. And it has 12 guiding principles. Okay, you protect the privacy and the integrity of the individual. You get informed consent to the best of your ability. Okay, there has to be valid scientific benefits to any research done. Okay, it has to be built on those scientific principles that were laid out earlier in the Nuremberg Code and the Helsinki Declaration. The benefits have to outweigh the risks. Okay, so this is a cost-benefit analysis. There is going to be a cost no matter what you're doing. If you're studying human beings, there is always a cost. Any new drug always has the risk of death. Okay, we have to say that whatever that risk is, there has to be a benefit that far outweighs it. Okay, it can't be equal, can't be an equal benefit, equal risk, can't even be close. It has to far outweigh. We have to do this research in the purposes of publishing our findings. We have to protect the control group from contamination, and we have to weigh the individual's well-being versus the needs of society and science. Now, all of this led to the formation of the BELMONT Report in 1979. If you go to work for the health department, you will read and study and memorize the BELMONT Report. In fact, the CDC basically requires you to memorize it. Okay. The 1979 report for the National Commission of Protection of Human Subjects of Biomedical and Behavioral Research resulted in common rule legislation. And carrying out its charge, the Commission prepared the BELMONT Report in 1979. It's a statement of basic ethical guidelines and principles that provide an analytic framework to the resolution of ethical problems arising from research with human subjects. The framework of the BELMONT Report is presented in 3 discussion topics: boundaries between the practice and research, basic ethical principles, and applications. Okay, and these primary areas of application include informed consent, assessment of risks, and the benefits and the selection of subjects. The core principles are respects for persons, beneficence, and justice. So let's look at these individually. When I say respect for persons, what I'm actually saying is that we have to treat all individuals as autonomous people. Okay? We have to allow individuals to choose for themselves. Even persons with limited autonomy need additional protection, even to the point of excluding them from activities that may harm them. The extent of this protection depends upon the risk of harm and the likelihood of benefit. Okay, this means that they should have informed consent, that they should know what the purpose of the research is, and that those who are either mentally unable to make a decision or physically unable to make a decision, such as a fetus is considered unable to give informed consent on research. A prisoner, for instance, cannot give informed consent. So anyone who cannot give consent, we have to weigh the risks versus the benefit, and in most cases we should probably exclude those individuals. It really depends on what you're trying to do. Now, the judgment that any individual lacks autonomy should be periodically reevaluated and will vary across situations. What this means is that you should get informed consent throughout the study. Okay, so let's just go to social science because that's what a lot of us are. If you are interviewing an individual about a traumatic event in their lives, you should, throughout, ask whether or not they want to continue. If the person looks like they're getting upset or having a moment where they don't want to continue, you should immediately stop and say, we can stop. I can see you're upset. Um, or do you give consent to continue, right? That's what part of this respect means. When we talk about benefits, these obligations affect both the researcher and society. Investigators are required to give the forethought on the maximization of benefits and the reductions of risk that may be involved in the research. So we have to think about what could happen if this research is published. What could happen if someone finds out that a particular person was a part of this research? Okay, what if you have a disease like HIV and someone can figure out who you are because of what is written in this publication? That could severely hurt you, right? That could hurt you, especially if you don't want a lot of people to know. All right. We should also recognize the longer term benefits and risks that may result from the improvement of knowledge and from the development of novel medical, psychological, and social processes and procedures, right? So this is where that weighing comes in. We have to weigh as a researcher, this risk to the individual. Does it outweigh any benefit that we can get for the individual or for society, right? There should be benefits for both, okay? So staying with the idea of COVID, okay? I'm going to give someone an experimental drug. There should be the benefit of curing or at least helping a person live, right? That should be a benefit to the individual. But at the same time, there should also be the benefit of that should work for everybody or most people, okay? So this is where that comes in. You have to weigh these. What are the benefits? What are the costs, right? If the drug that you give kills a certain percentage of the people who take it, well, first of all, what percentage is considered acceptable? There's a phrase called acceptable causality, okay? What are the acceptable casualties here? What are acceptable? How many people can die? Okay? We have to weigh that versus the greater society. Okay? The last aspect of this is justice. We have to treat everyone fairly and treat them the same. We cannot exploit anyone just because they're readily available or easily malleable. This is why children are a protected group, right? Children are very easy to exploit. They're usually very willing to help, and you can shape them and mold them into what you want them to be. We also have to make sure that there's a fair distribution of risk and benefits, no matter what the problem or issue is under investigation. Everyone should benefit and risk the same things at all times. So, what are some of these protected groups? Well, women, and this is mostly because women can be pregnant, okay? And because they can be pregnant, the unborn child does not have a say in any medical treatment that the woman undertakes. Okay, children are a protected group because children do not understand necessarily what the risks that they may be facing are. People who are experiencing war or terror situations, okay, may not really fully understand what it is they're signing up for. Okay, disaster victims, that's kind of the same thing. All right, indigenous populations, minority groups. Okay, we have to make sure we're not singling groups out, that we're not overexposing groups who have already been the victims of scientific malpractice. Okay, to make sure that they are not being harmed more than they have been harmed in the past from scientific experiments. We need to protect these different groups. Okay, prisoners cannot give informed consent. Neither can the military. Why do you think that might be? Well, if you're in the military and your commanding officer tells you to go get this drug and just take it, are you going to tell them no? The same if you're in prison. If the warden says, I want you to take this drug, do you think the prisoner feels like they can say no? Okay. Refugees and internal migrants. This is the same thing as with Native peoples and minority groups. These are people who can be exploited. These are people who can be easily forced into thinking that they have to do this in order to be allowed into society. People who are mentally handicapped in some way can't give informed consent. Okay, they have to be protected. If you suffer from a disease like schizophrenia, can you honestly say, yes, I want to try this drug? It depends. So we have to protect people in that category. Then there's rural versus urban. Okay, the reason for this is that rural individuals tend to be exposed to certain things that urban people aren't, and vice versa. Okay, so we have to take into consideration where someone lives, their geographic location, and whether or not that person should be protected. Okay, we don't want to try and study rural people and make them think that they need to bend to a specific experiment because they haven't been given proper education on what this experiment could be. Now, one of the things that we should consider in a university setting or working for the health department is how do we go about our research? And one of the first things that we have to do as researchers is get permission. And this happens through the Institutional Review Board, or the IRB. Okay. Now, the purpose of the IRB is to review research involving human participants to ensure participants are protected and research meets ethical standards. The IRB is charged with facilitating and approving the responsible use of humans in research endeavors. So, those categories that I just listed, you have to list on your IRB form exactly how many people of each racial group are going to be in your study. You have to list how many men and how many women are going to be in your study. You have to tell them if you have anybody over the age of 65. You have to tell them if you're going to do children, anyone under the age of 18. And the reasons for this is that the IRB's purpose is to make sure that you are protecting all of the people in your study, that you are not taking advantage of groups, that you are not doing unethical things to groups, right? Experiments like the Tuskegee experiment, like Baby Albert, those things would never get approved today. And the reason is that not only are they horrific, but they violate pretty much every principle that research should follow today. Okay, and so the IRB is a group of individuals, typically scientists and researchers from different disciplines that sit and they review your study. So before you can ever do anything, they go through your study and see whether or not what you do will violate the principles and guidelines of like the BELMONT report. Okay, so they look at to see if there are any risks that you haven't thought of, and then they make you go back and talk about how you're going to minimize those risks. Okay, now once it's approved, okay, they trust that you're going to do things the way that was talked about in the IRB. And every year after that, you have to renew the IRB application and show the IRB group that you are following the guidelines that they set. And if they want changes, they make you make changes then. You have to do this with all human research. Okay, so this is if you're working in chemistry and you create a drug. Before you can test it on anybody, you have to get IRB approval. If you are doing qualitative interviews in sociology to ask about their gender identity, you have to get IRB approval before you can talk to them, because these types of questions, even in a qualitative study, can bring harm to people. So the best thing to think about is like the Hippocratic Oath, where you bring no harm. That should be first and foremost to any scientific endeavor. The last slide that we're going to talk about today is thinking about, I'm just going to ask some questions. Let's just think about these together. Does society have a responsibility to protect all of its citizens? And if so, is that a form of paternalism? And what I mean by that is, are we treating people like children? Is society saying, oh, you're just not good enough to make your own decisions. We're going to make them for you. Okay? Does that even matter? Okay? Are people even able to make their own decisions? If you look around at the number of people who are going out and about society without masks, it's questionable whether or not everyone can make the right decisions about the health of society. So maybe society does have a responsibility to force people. This is one of the ethical questions that you have to think about. Does the individual right to freedom, okay, mean that you can reject the responsibility of the state when it comes to health? So thinking about the Michigan protest where the armed gunmen went into the Capitol building without masks, were yelling at the officers inches from their face. COVID was very much at its peak. Okay. Does the individual rights, though, to protest and to gather mean that they could do that and the state doesn't have a right to tell them to go home? The state doesn't have a right to make them wear a mask? This is another ethical consideration. A third thing, do we need informed consent for all interventions? How many of you gave consent to put fluoride in your tap water? Anybody? I don't remember ever actually signing that paper. But what does fluoride do? Well, it protects our teeth, okay? And that was found to be a useful intervention, right, that none of us consented to. Do individual rights override social responsibility? Okay. If I have an STD or HIV, do I have to tell the health department who my sex partners are? Do I have to let them trace it so that they can figure it out? Or should those people be protected, right? And should my right to privacy be protected? Your readings should talk about the precautionary principle. With this is the idea that we should that our experiments and research will have the lowest possible risk. Okay. Does this mean that there should be no risk for this medication or public health intervention? So if we come up with a vaccine for COVID, but a very, very minute percentage of the population dies from the vaccine, is that enough to throw the whole vaccine in the trash? Do we really need equity in health? Is it fair to force equity? And last, how do we determine funding and its allocation? Now, I have my own views about most of these questions. I'm not going to share my thoughts on these things. I just want you to think about them. Because if you stay in public health, if you stay in this line of work, you're going to be faced with answering these questions every day. Okay? You're going to have to constantly weigh in your mind where people's rights end, where society's rights end, what is fair, what is equal, whether or not even the state has the right to decide most of these things. Okay? These are questions that you yourself will each have to look into and answer. Okay, I'm going to end here. Have a great rest of your week. If you have any questions, please reach out to me. Please, if you have any questions about your paper, reach out to me about that. I will talk to you next week.